watching the Bulldog Brewhouse Podcast.
Hey folks, it's Steve Grover back here for another episode of the Bulldog Brewhouse Podcast. So, we want to shift gears a little bit. I know we talked about motorcycling, but now we want to talk about something that's very important in Alberta is healthcare. And, obviously taking care of your health is very important. And also, knowing that half my family are doctors, there's a huge shortage of doctors here in Alberta. It's very hard to find a family physician in Alberta. But just before I get started, I want to put a shout out to Ep.6. They are the sponsor for tonight's episode. If you've never tried Ep.6, go down and visit my friends Reggie and his wife Tanya. Great sub sandwiches on 3518A 2nd Street Avenue Southeast on the corner of Barlow and 61st Avenue. So give them a call or just head down there, and I trust Reggie and Tanya will take care of your appetite needs, okay? So my guest tonight is the famous Dr. Marc Klasa. Marc, how are you doing?
Not too bad at all, Steve. How are you doing today?
Good. Had a busy day in court today again, trying to bring justice to injured clients in Alberta and make some money in the meantime to pay my bills. But I'm so happy for you to be here. Obviously, you are a family doctor, so could you explain a little bit of who you are, where you came from, and how the hell did you end up in Alberta?
Sure. Basically, the family physician 4 days a week that sees all ages of people from cradle to grave. And then because I'm diabetic myself and I've been type 1 since age 14, kind of got into treating diabetic patients a lot early in my career. And then as time went by, kind of had to deal with some diabetic patients who had not been cared for or had not had care for a large number of years before I met them. We got their sugars under control, but it didn't quite fix all of the issues they had with nerve pain. So I kind of got into doing more of the chronic pain side as well. So now 1 day a week, actually it was today, I run the chronic pain med management program at the Calio Spine Clinic, working with the spinal surgeons and a couple of rheumatologists.
Okay, and so where are you originally from? Are you from Calgary or Airdrie?
Nope. It kind of gives it away with the symbol. I'm still loyal to the teams from the old hometown.
Yeah.
I grew up in Montreal, so actually in the hood in Montreal, St. Leonard in the northeast. And basically, still a Habs fan, still I'm an Alouettes fan. But as you know well, also have my loyalties out here. So we have season tickets for the Roughnecks for lacrosse and season tickets for the Dogs down in Okotoks for baseball.
All right, okay, really cool. And obviously I'm wearing an old Expos and Tim Raines jersey just
had
for
season
you.
Tickets many moons ago, bro.
The only memory I have of the Expos is playing in the Big O.
Yes.
And they're in the playoffs against the Dodgers. And
Yep.
I don't remember what grade, maybe it was grade 6 or 7, that's how old I was. And we stopped the whole school, and we went into the gym, and we watched the Dodgers beat the Expos just to miss out on the World Series. Remember that series?
Very much so.
Yeah.
And then their only other good kick at the can, where probably they should have won the World Series, and then it would have been them against the Yanks, but the strike canceled the series.
Oh, okay.
And that was in the 90s. So basically, it was just kind of bad luck and bad timing.
Okay, so where did you go to medical school? You didn't go to one of those Grenada kind of medical schools where you pay to get in?
I'm a little too pale for the area,
right.
And I would get too much sunburn. Nah, did some school in the old hometown, did some school out here. So I did my undergrad before med school and everything before that, high school and all the rest in Montreal, and then did med school at McGill.
Okay.
And then finished up med school at McGill in '95, and it's hard for people to understand that now, but it was a very different time. At that point in time, you could get your specialty and your med school training in Canada, be qualified to practice in any province, but you wouldn't necessarily get a billing number from the province unless you did either your med school or your residency in that province. So I didn't want to run the risk of being stuck exclusively with Quebec as my only option. Mm-hmm. And I'm fluent in French. I did a minor in comp sci, so I'm grandfathered. I wouldn't have to write any French proficiency exams.
Yeah, okay.
But I decided to just do all the interviews across Canada for residency and see what place kind of struck my fancy. And ended up going up to Edmonton and doing my specialty in family medicine at the University of Alberta.
Okay.
Which I really, to this day, I still think it was the best mix of both high level of education,
Yeah.
and a great life outside of school on a limited budget that is a residence salary.
Okay, and it's obviously, I know you for a while. Obviously, you knew my father, Dr. Grover.
Yeah.
He's sort of a mentor to you.
Very much so.
Unfortunately, he passed away over 20 years ago. Complications from diabetes, too. I mean, and that's a real interest. You're a juvenile diabetic, right?
Correct.
Okay, and we'll get into that. So you came out west to U of A. You obviously met your partners there, and you ended up working with them here in Calgary in a clinic, right?
Yep.
Okay.
We've known each other. And then me and Dr. Rob Wong and Dr. Kuldeep Ayer have known each other since '95.
Okay.
And we've been in the same clinic since about 2004.
So now, an interesting fact you told me about is you weren't sure if you're going to go to law school or med school, and I think you got into both.
Correct. Well, here's the thing.
Yeah.
I didn't want to take a chance. And now, growing up in Quebec, basically, you have an opportunity also to get into med school right out of what we call CJ, which would be like your grade 12 and 1 extra year.
Okay.
I put in my application, didn't work out that time, then did my undergrad in chemistry. Then after that, I said, I don't want to do any extra training, anything else like that. I want a career, one way or another, that's determined in 4 years.
Mm-hmm.
So my first pick was med. Second pick was law.
Yeah.
Third pick was the computer science co-op at Concordia University, which would have still gotten a pretty good job. Mm-hmm. And my fourth pick, and you know this well from me, I really love driving, and that kind of ties in with some of the stuff you do, Ben. And actually, my fourth pick, if I had not got any of those, was professional truck driver.
Okay. So did you actually get your CDL or no?
Commercial
driver's license?
No, I never got around to it. And all I got is a basic class 5. But it kind of was tempted at one time, but never got around to it.
Okay. So you never thought of, have you ever thought of giving up medicine and you're riding the rigs across Iowa, down to Florida, getting shot at, at a rest area or anything like that?
Or getting stabbed at once here in Canada, either way. No, I'll take a pass. And I still do a lot of driving, but it's for fun.
Yeah.
Most of the vacations me and my wife Rita take, I'd say at least 75% of them involve driving trips across over Canada and the United States.
Okay. And so you mentioned your wife Rita. I know her also. She's a massage therapist, so you're both in the medical field?
Correct.
So,
she does a little bit of subspecialty work too, kind of splits it up. Her main gig, of course, is massage therapy, but she also got all the training to do active release techniques, which is the breaking down of scar tissue and muscles for people who have had even more kind of serious injuries, stuff a lot of your clients might face.
Yeah.
And so she also does that and is fully certified at the master's level for that.
Okay, cool. So let's talk about medicine. You go to medical school.
Yeah.
You go to McGill, which is a very good school.
Yep.
You come out to Alberta.
Yep.
Is there, other than you just didn't want to live in Quebec, is that the reason why you came out to Alberta?
I like having options.
Yeah.
And again, I'm fluent in French. I could have worked in Quebec. It's not the end of the world.
Yeah.
But the fact of the matter is, I didn't want to be locked into one place.
Okay.
The kids who do med school nowadays, that's not even a thought. You can go pretty much anywhere. There's such demand.
Okay.
So it was just a chance, and also a chance to go and see a part of the country I had traveled briefly to, but to actually live in that part of the country and see something different.
Yeah.
I gotta say, since originally in Edmonton, and then 3 years later moving down to Calgary, I gotta say I think I made the right choice. And then Alberta, in terms of the quality of life, and actually in terms of healthcare, is by far the best in Canada.
Okay, but obviously the food's not as good as Montreal.
It depends what.
Yeah.
With the exception of maybe Moisha's Steakhouse in Montreal, and you're definitely not going to find steak anywhere near as good as what you get in Alberta, in Quebec.
Yeah.
But in terms of some forms, like especially more Lebanese cuisine, French cuisine, stuff like that.
Alibaba is pretty famous on St. Catherine Street in Montreal. I remember going there.
Oh yeah, those they are special.
Yeah.
But good news is I like steak.
Okay, cool. Yeah, and obviously you came out to the right province, to have a steak out here in Alberta. I mean, we're known for beef, oil, and that's about it, like Texas or the north. So
pretty much.
So if anyone's out there, there's a lot of people, you always meet people younger, like I want to be a lawyer and I want to be a doctor. And, a lot of those people don't end up doing it.
Yeah.
What's the medical field like as a doctor to get into right now in the 21st century? If someone's thinking of getting into that area right now?
And here's the thing, right now it's arguably even a little tougher to get in.
Yeah.
And the reason that is basically there's more people applying,
Yeah.
and there's a bigger population,
Yeah.
and yet that is one beef I think many of us have with all levels of government,
Yeah.
was that around the 80s and 90s, they scaled back on expanding the number of spots or even cut spots in
Yeah.
med school
Okay.
in all provinces.
Yeah.
And now we're significantly behind the eight ball. I was just reading an article, I think 2 days ago, that showed that basically the guesstimate right now is that Canada is short 20 grand of family docs, and about 42,000 docs overall.
Yeah.
And the expectation is, with how our population is growing,
Yeah.
that might be more like about 50 grand family docs short by somewhere in the vicinity of 2035.
So what's the reasons for that? Is our population growing and there's not enough doctors?
And they haven't expanded the number of spots. They are starting to now,
Yeah.
but for the longest time they did not expand.
So, I mean, I know a lot of patients out there. I was talking to a client of mine today saying, actually it was the other day, he's in the unit 44 of the Foothills, and he says, I don't have a family doctor. And I'll say, I'll try and find you one. Well, like, it's really hard for people to find family doctors in Alberta. What is the secret to find one? Is there one at all or no?
It at least it gets you into the line for potentially finding one.
Yeah.
What has been quite successful in many ways, not just for that, but for other things too, is the primary care networks in Alberta.
Yeah.
They are by far the most well organized groups in Canada. They blow away what they have in Ontario.
Okay.
Like for example, I'm a member of the Mosaic Primary Care Network in the Northeast.
Yeah.
And they have, and you can go onto their website and register saying that you need a new family physician. They put you on a list, and they also are trying to help speed that process.
Yeah.
So they have these urgent care clinics that also cover for our patients after hours.
Yeah.
And what they're trying to also do is get recent graduates or new docs moving into the province to work in those clinics maybe 1 to 2 years.
Yeah.
Get their feet wet in Alberta,
Yeah.
see those patients.
Yeah.
Then when they want to move to their own office and set up their own office, if they so choose,
Yeah.
they take those patients with them as
Okay.
their new practice.
Yeah. Yeah.
So I would highly recommend for anybody looking for a family doc, at the very least, find out what is your local primary care network.
Yeah.
You can pretty much find it out by just calling 311 and asking that information or whatever the case may be.
Okay.
And then either go online or phone the number and get your name put on the list.
Okay, so remember, folks, don't call 911, call 311, and maybe you'll find a family doctor, okay? Otherwise, you'll probably have the cops at your front door if you call 911. Okay.
And it'll all get blamed on poor Steve.
Okay. So, I mean, obviously health is the number one concern. I always believe you should have your health over money. Money comes and goes, but even if you have $1 billion and you've got terrible health, what's the use of having the money?
Yeah, you have no quality of life.
So everyone, like I always read in the paper, healthcare is terrible in Alberta, terrible in Canada. What's the real truth about healthcare in Canada? You know what I'm saying?
There are parts of Canada where it's very much hurting. I don't think even most docs actually, or specialists believe that it is terrible in Alberta.
Yeah.
And actually not terrible in most provinces. There's definitely trouble in some areas.
Yeah.
Where a lot of the harm came for Alberta ties in with not enough docs and the fact that our population, if anything, is growing faster than most other areas.
Yeah.
But at least we're not like the mess that it is in British Columbia, where they're having to send cancer patients and the provincial government's paying American bills for it to send them to Washington State because they don't have enough spots available to treat them in province.
Okay.
That's whole new levels of dangerous and hard on the patient care.
Yeah. Okay. So the healthcare, I mean, honestly, I know you go to a lot of conferences. I know you go to the US a lot.
Yeah.
And worldwide, where would you put healthcare in Canada compared to the rest of the world?
Definitely, I wouldn't say the top for sure, because who seems to do best for that is European nations.
Okay.
And the reason this is my personal take it for what it's worth.
Yeah.
I believe that you can't be too hardcore in one direction or another. Most of the European nations have a mix of both private and public healthcare. In North America, I think what's harming us is that both our nation and the nation directly to our south are too hardcore in each direction. In the US, it's all private and they almost fear public. In Canada, it's the exact same thing. And if you go hardcore in either direction, I think it limits you so much that you end up failing.
Okay.
And and in terms of and I'll tell you straight up, even if there was the ability to do private healthcare here in Canada to a substantial degree, I wouldn't want to do it. It's a pain in the butt to have to deal with 16 different insurance companies' billing systems. You know how harsh that can be. But so I would stick with what I'm doing right now, just one payer, the government, and not change anything up. Okay. But I can see why there would be some people who could tolerate that, and finding that middle ground. Well, that seems to be what most European nations do, and they're doing a lot better than we are.
So give me an example. Europe's a big continent. What's a country that you respect their medical system as a doctor?
And the most of the because they have also more resources and it's been that way for longer. The Western European countries, then Germany, and then Britain, and France. They all do well, and they're also, especially the the Scandinavian countries.
Yeah, the Vikings in Norway.
Yeah.
I mean, they have so much money in the Heritage Fund. We blew our Heritage Fund in Alberta, but the Norwegians kept all their money, and I think they make more interest off that than probably Alberta makes in revenue.
It's close.
Yeah,
I think you are right.
Yeah.
And Sweden, another case in point.
Finland too.
Yeah.
Okay.
Yeah.
So, but what's so let's take Norway.
Yeah.
Is there just more access to healthcare in Norway than Canada? Like you get an MRI quicker than Canada?
To be fair, you get an MRI quicker in most countries than Canada.
Yeah.
But there is some room to maneuver on that now because at least in certain provinces you can get private MRIs.
Yeah.
As you know well, you probably use it for your clients.
We do it for our clients because I want to know exactly what's going on with my clients' lower back injury or neck. If there's a sciatica problem, if there's a disc herniation, maybe a wedge fracture, and we'll pay, for a private MRI clinic. We work with here an MRI clinic here in Calgary, Canada Diagnostics Center. I'm very happy with them.
Right.
But the average person, they're living paycheck to paycheck.
They won't be able to pull that off.
And so what is the delay in getting an MRI? Because you go for an X-ray. Like I've heard from my clients, like they won't even check me for an X-ray or a CT scan. They just throw me out of the emergency room. Is there just not the interest of spending the money on radiological reports, or what's the problem with that?
In terms of the ERs, I can't say for sure what the problem is because it's been a lot of years since I actually did ER. There was a time, but I would have been back still when I was back in Edmonton actually, and just early first practicing. So I haven't done any ER work in about a quarter century.
Okay.
But in terms of what you're referring to, like if from an office-based practice, at either of my offices, Cali or Family Med, as you know well, you give the patient a form for an X-ray. You can walk in any X-ray clinic and get it done right away. And if you need an ultrasound, maybe it takes a week or two. In terms of the more complex ones, like a CT scan or an MRI. Why there's that demand for those private services is because oftentimes your wait times are pushing the 6-month mark or longer.
So what's the delay? Because if you came and saw me as a client tomorrow, you're in an accident, boom, I can get you an MRI by Friday, or given the fact that Monday's a holiday because Canada a long week, I get you in Tuesday.
Correct.
So what is the problem in the system that they can't see our people, regular Joe Albertan who needs help within 30 days of requesting an MRI? What's the issue?
Funding the issues that do not allow them to necessarily get enough machines. Okay. It's very easy for, like, the average in the price, as you know well, for a private MRI is somewhere between like $700 and $900, maybe $1,000.
Is that to do 3 Tesla?
Yeah.
Okay. Reading machine.
Yeah. Okay. And if you're doing that for each patient, yes, it's a lot of investment from the radiological firm to buy it at first. Yeah. But then it pays itself pretty good, and then eventually you're going to have enough money to buy another one if you need it, and another one. The funding for the public system is based on an annual budget for the Alberta Health. I just don't think you can react quite as quickly, and with that many different competing interests, they don't want to throw everything at the radiology department and then not have funding for the primary care networks. You know what I mean? Like something's got to give on each location.
Yeah, but we do live in Alberta. I was born here. I was raised in Alberta. There's oil everywhere. There's oil money everywhere. I mean, I look at houses in Calgary and they're selling for like $9 million.
Correct.
Like that's ridiculous. Okay,
Yes.
So if there's so much oil money in Alberta, why is there just a restriction that the Alberta government can't throw money more? Because healthcare is really important at the end of the day. You know, if you got a lower back injury and it turns out to be a tumor, and you got to wait a year for an MRI, that doesn't help the general public. It doesn't help the average person out there. And that's what I'm really concerned about.
Especially if it's something of deadly seriousness, like what you're referring to.
Yeah.
No, I don't think that it's an issue with that. It's just that the funding side of things, to expand all of that funding in all these different directions, I just think it kind of scares any type of political group. It doesn't matter which party it is, because unfortunately the catch is the minute that one group starts getting more money, others start asking for more money as well.
Yeah, but I mean, you're looking at healthcare. I mean, there's obviously the doctors, and my mom was a nurse, and nurses do a great job. And then there's LPNs, and then there's respiratory therapists, and you know, we're all physiotherapists and kinesiologists.
This, that,
yeah. But at the end of the day, like, you know, I've traveled the world, and I'll let you know, Canada is the best country in the world to live in. I'm sorry to say that, okay? It's almost like the Norway of North America. You're always going to have food here. The government will give you shelter, and you'll always have ability to have clothes. You'll always have an education for your kid. If you want to get a grade 12 education, you'll get it for sure.
Because it's covered.
If you want to get that college education, you know, you'll find some way to get the financing. But at the end of the day, you know, when you're talking about people waiting 6 months for an MRI, you're talking about, like, even family members I know. My old uncle, he passed away now 2 years ago. He waited 2.5 years to have back surgery, and he ended up just doing a private clinic in the U.S. I mean, that's not fair, you understand?
Well, that's what we're talking about in terms of expanding access. And theoretically, that's why the European nations do better, because if you do have those private options as well available, there's always this fear that, if somebody's only those with money are going to get it done faster. Dude, you can make that argument, but if they're actually then exiting the existing public system, it is going to push all the other people on that wait list higher up to the surface.
So this is my next question I got to ask, and you know, Ralph Klein always, you know, this has been going back and forth. Are we going to have a two-tier system in Alberta? Do we have a two-tier system? If you have money, you can access an MRI. If you have money, you can go get that back surgery.
Correct.
So do we have a two-tier system in Alberta?
Because of the nature of the country right next door to us, which is so easily accessible, it's a two-tier system that's been in place forever. It already exists. And it just that instead of getting any particular specialist and getting something back from it, where the specialist or the hospital that does the treatment pays taxes in Alberta, where some at least will come back into it. Instead, those tax dollars, like your uncle, like you were talking about, are going to the Mayo Clinic, and it's Minnesota that's getting the benefits.
Okay. And then the other thing I always hear is, you know, even if I can get a doctor, he or she spends 30 seconds with me, boom, out the door, and then, you know, you see these signs like only one complaint per visit. If you have another complaint, you know, doctors get a bad rep for that. I know that, but I know they're doing their best. I mean, my dad worked hard as a doctor. My sister's a doctor, family GP, you know her. Why is it there's this in and out? Like, I hear from people, and, you know, like, why can't they see me for 2-3 complaints? I have to come back. What's the system set up that way?
Here's the thing. I would, in our office, we never put those signs up. And the reason being is because if you're putting that sign up and you're treating somebody who's in the medical community, okay, they get it, and they would know what's different. For many, the condition, the symptoms that point towards one particular diagnosis might be in like 3 or 4 different systems, and will feel different to the person. If you don't hear about those symptoms that they're having, all of them, that the patient themselves might think are different conditions, you might miss a key diagnosis. So, and like I've always felt uncomfortable with any doc who actually put those signs up. It just seemed a little bit, I'll say what I think, unprofessional to me.
Yeah, okay.
And in terms of how can you still make it work, the reason why they do a lot of these things is because we're still fee for service, and certain clinics would like to pump through a larger number of patients per day, because since fee for service, more people you see, the more fees you get for for those, you make more money throughout that day. It is an issue. Is it super common amongst the medical community? I would say no. I'd say the vast majority of the medical community still actually does the job right and cares about the patients enough that they're not going to hustle them out the door. But can I say that is 100% the case? No.
Okay.
It is what it is.
So the other complications you hear about in the news, or even in my clinic, like, I got to see an orthopedic surgeon, and there's the wait time for that, or a neurologist. What's the delay? Like, obviously you have to go see your family GP first, get the referral to the neurologist. Why is there such this delay time in Alberta? Like, we live in the best province in Canada. That's my view.
Not enough of them. That's what it comes down to. And then, like, remember I was mentioning about that lack of family docs that's going to expand. Well, again, right now we're about 20,000 family docs short in our nation, basically. But we're 40. I think the number they quoted was 46,000 total docs short. So yes, the majority is shortage of family docs. But there's a shortage of all other specialties too.
So what's the solution? To just let a bunch of foreign doctors into Canada, or just let people go to America or South America or India or Caribbean for medical school and just bring them back right away for residency?
In the short term, and they are starting to do this, is expand the number of foreign trained physicians who can hopefully have less hoops to go through to get qualified to practice here in Canada. That's one thing for sure. The other thing that's being expanded is the number of spots in, I call it med school classes in universities and residency positions. But the catch is that takes, number one, the minute you add in those extra spots, you're still talking about, for med school, let's say, it's talking about 6 years before that first cohort of more docs will graduate if they do family. Could be anywhere, if they're a super specialized neurologist, could be 12 years.
I know.
So basically, or neurosurgeon, sorry. So it's not something that's going to take turn things around quickly, but it's still something you got to do to plan for the future.
And then when I go to the U.S. a lot, I went to school in the U.S. and you always hear, Canada has got this preventive medicine program. Is that true? Or is that just the U.S. media talking about socialized medicine in Alberta or in Canada in general, and then the Republicans go crazy? We don't want socialized medicine, So do we have a really preventive program to, trying to get people healthy, to avoid seeing the doctor, or is that not just a myth?
I think we all would like to accomplish that. That said, I don't really think most nations in the world have really managed that. Then having access to the physician, we try our best, and we also from the day that we start to see the newborns. What we do height and weight measurements. We check on nutrition status, all that. We've succeeded quite well on lessening the amount of childhood illnesses because that follow up occurs. But it also comes down to the patients having to actually take the time out of their day too. And you and I can remember back when even though your dad was a physician, even though my bro was a physician, how often did either of us bother going to see our family doc in the times we were in university, undergrad, early parts of our career? Probably not much.
Unless it was certainly urgent.
If you dislocated an ankle playing ball hockey.
I started doing working on my chest. Then also I thought, oh my dad, I'm having a heart attack.
Exactly.
Pain. Steve, you're bloody crazy again. Slap me in the face.
True that. And he was wise. That's where we might be losing out because we only see the world enough to call them the kids. These are adults, but young adults. usually when they get injured with something from sports or other activities.
Yeah.
Other than that, when you start seeing patients regularly, even if they're 100% otherwise healthy, for follow-up and stuff like that, that's usually once they get into the age where they've already had kids, or they had to buy life insurance or stuff like that.
Yeah.
So you start seeing them in their mid-30s to 40s, late 40s.
Yeah.
Other than that, and the services are there.
Yeah.
They could go and see their family docs on an annual basis for a general checkup and for just discussing preventative stuff.
Yeah.
But they just oftentimes people are just too busy, or so they claim.
Yeah.
Until kind of the shit hits the fan and they develop a severe condition of some sort.
So honestly, and like I mentioned before, you go to the U.S. a lot. You take a lot of conferences down there. You talk to a lot of U.S. doctors.
Yeah.
If you had to live in one country and had to pick it based on healthcare, would you live in Canada or America? Given the fact, and say you're not a doctor, okay?
Yeah.
Where would you live?
I'd still stay with Canada because I think there's definitely enough advantages in multiple ways, like you discussed, with our nation. And plus, you can't underestimate, it's the reason you came back too, bro, the loyalty factor. What's home? Yeah. And so basically, the fact of the matter is, I think that would be my first choice overall, no matter what. Yeah. But that said, we have another good buddy of ours, the good Dr. Wong in my practice, where he's now here. He's got an established family practice and has for a long time. Yeah. But he wanted to try something different, so I actually worked as a family physician in inland Northern California, for 3-4 years? Yeah. Before he came back.
Yeah, near Sacramento.
Yeah. So it's a chance to try out different things.
But I just want to talk generally. See, you're the average person, making $60,000 a year, paying paycheck to paycheck. You got a wife, a kid, mortgage, and healthcare is a big concern for you. Yeah. Would you live in the States or Canada?
It's probably still better to be in Canada because at least you got the baseline availability of everything.
Okay.
Now, what a lot of people tend to forget, we're all aware of it, but a lot of our American colleagues. Because sometimes you go to a conference and they say, but it's so great, for those types of patients you mentioned, you have coverage for everything. Yeah. Well, kinda. Yeah. On the other hand, if they want to see a dentist, they better have a plan through their work. Yeah. If they don't want to pay out of pocket for the full value of all their medications, they better have a plan. Yeah. So it's and the look of absolute utter disbelief, even amongst the medical community, when you say something like that at an American conference. Yeah. It just goes to show that how little a lot of the American medical community is aware of the limitations that exist in other systems.
Yeah, okay. All right. So, I got to talk to you about this. On May 29th, there was the big provincial election. Yeah. Okay, and, the UCP won. Yeah. They did lose 14 seats to the NDP. Yeah. And it looks like everyone that was involved in healthcare, given from Jason Coping to whoever, lost all their seats. Yes. And what was all that about? Just the general public was not happy with the healthcare system, and what was their concern from your doctor perspective?
It would be nice for me to say that I really thought the decisions were made exclusively based on healthcare or not. Yeah. I don't think it was. No. They were individual riding issues, and the fact of the matter was that those particular ministers were located in urban ridings that, in general, in our nation, tend to lean more towards the progressive left. Mm-hmm. And basically, I think one way or another, they probably weren't going to, it was going to end up the way it ended up no matter what. Yeah, okay. Now, that said, moving forward, does it harm a lot moving forward? We've been kind of all over the map from the governmental approach to healthcare. Yeah. And I'm not really, maybe I'm just cynical and bitter, but basically I don't really think that there was any better healthcare or any better offers when the NDP was in power either. Yeah. I think both sides are a lot of talk and not really making much of an effort. Okay. That said, from what we know, from what's shared with us from because as you probably know, I'm also still a member and I'm past president of the AMA section of chronic pain. Yeah. And that's the Alberta Medical Association. Correct. That people don't. It's not the
Alberta Motor Association,
No,
right? Okay.
but the main AMA board and the current AMA and the press, they keep us up to date. They send us emails about the discussions they have with government and what have you. And it seems like the discussions are happening and are progressing at this point in time for changes in, not necessarily huge changes, but at least funding changes, more stability changes in healthcare. And I must say, like, unless it's just our AMA head, who is excellent, unless she's just one who sends out more emails and updates us more than past presidents had. But if that is not the case, it definitely seems like more is heading in the right direction of late than I've seen in a while.
Okay, and a lot of people talked about the backlash during COVID. The medical system wasn't ready for COVID in Alberta. A lot of deaths happened. We were so behind in vaccinations, and that was this whirlwind that happened. The news says about all these health ministers or people involved in the government losing their seats. Like, what was your perspective of the issue of how Alberta handled COVID?
Alberta didn't do any worse for COVID than most other areas did. The major issue, and this dates back, I saw this back in med school in Montreal. The biggest issue, aside from training physicians, which they cut back on, that is limiting us, and especially with regards to emergency rooms, is a massive lack of investment in additional either long-term care facilities for those who need it, or home care, long-term care facilities for people who still want to live with multi-generational families, the grandmama and grandpapa, that have serious medical conditions. The family can help a bit, but they need some help. And because there's such a lack on that, until one of those spots frees up, where do those patients sit? They sit in the wards of general internal medicine at all our hospitals, occupying a bed when the hospital is not doing any active treatment. And then because they're on those beds there, the emergencies a patient, stabilizes them, and wants to get them admitted to a hospital bed so that they can free up another emerge bed. That can't happen. So the biggest issue, in my personal opinion, that's backlogging the system massively across the board, almost in every domain, because it even limits, if you have that limited beds in the hospital, even if there's some free slots in the operating room, well, where's the patient going to go after the operation? So it backlogs everybody. So if I had my dream for one spot to focus a bit of additional funding on the healthcare, that I think would give the biggest bang for the buck, home long-term care support, and long-term care actual the buildings or long-term care kind of hospitals. And because if you can free up those existing beds in the hospitals, I think it would, and that is something that if those are available, it could turn things around very quickly.
Okay, so you think COVID was handled pretty good with the Alberta government, given the fact that it's a pandemic that happens every 100 years or so?
Nobody could have predicted it. And even the speed with which we kind of got out of it, because did anybody really anticipate that an Operation Warp Speed for a vaccine development would actually work? Well, and it actually did happen that fast.
Well, I remember it was January 2020. I was in the Munich airport coming back from Germany, and I saw some, people with masks on. But what the heck is this? And all of a sudden, by March, boom, the whole lights go off. The city shuts down. It looks like, I don't know if you remember that movie 28 Days. And the guy wakes up in the hospital. He walks around London and there's nobody around. It was kind of eerie. And as a doctor, what were you like? What was your main concern with COVID?
Here's the thing. Even from what we knew at that point in time, we knew it was going to be a big issue.
Okay.
But because actually, I don't know if I told you, I was actually at the last live face-to-face medical conference, as far as we know of, that was held before the world shut down. I was actually, and me and Rita were out in Alaska at the Alaska Academy of Family Physicians. And that conference wrapped up the day 2 days before St. Paddy's Day of 2020. And so we flew back into Calgary, and it was a late night flight. It was around midnight that we got back in, and for the life of me, I couldn't remember exactly where I parked the truck on, but I remembered which level at the parkade. And I said, well, if we can't quite find it, I'll just click the thing until I hear it beep.
Yeah.
Didn't have to.
Yeah.
We come out of the airport into the parkade on the level of the Delta Hotel there.
Yeah.
And where usually the most prized parking spots are.
Yeah.
On the entire level.
Yeah.
My truck and one other vehicle.
Yeah.
Well, we ain't in Kansas no more. So basically, even the discussion at the conference, because you saw it coming in Alaska amongst our Alaskan colleagues, was that basically it was definitely not a good situation.
Yeah.
But at the same time, as opposed to something like Ebola or something like that, at least not the majority of the patients getting infected were dying.
Yeah.
It could have been worse.
Yeah. Okay.
And then when we came back here, of course, they hadn't made the rule yet, but about a week later they did. So me and Rita were happy we erred on the side of caution and isolated at the house for 2 weeks.
Yeah.
But then after that, hey, as of funny enough, April 1st, 2020, I was vaccinating patients at the offices. And
obviously you had a mask on.
Here's the thing, we did, but basically, did we know, knowing what we know now, would it have made any huge difference? Probably not. Without the vaccines, the mask didn't really accomplish much. Yeah. Okay. And that's why we're in the world where we are today, where we don't need the masks anymore. Masks are great for bacteria, and that's why they were always used in the operating rooms. Yeah. So the surgeon wouldn't launch a bacteria into an open wound. Yeah. But for aerosolized viral particles, how much they really accomplish?
Yeah. But I was in the foothills about a week ago, and that was the day when they shut down. No more masks anymore. Because I was worried. I have to go see my client. Yeah. And then the lady admitted and said, "Don't worry, you don't need a mask now." And so the hospitals have gone back to non-masks now as of last week.
And that's evidence based, because basically there was a study that was presented at the European Infectious Disease Conference this past year. Yeah. And where they actually, in one of the hospitals in Britain, after Britain got rid of those rules, they actually compared the rates of infection and transmission of infection on wards in the same hospital, because some of the wards had no mask rules, the other ones did. Yeah. There was virtually no difference. So basically, in terms of that, at least thankfully, we know we are following the evidence by doing this.
Okay. So, talking about healthcare still, I mean, obviously diabetes is a real passion of yours, being a juvenile diabetic. Yeah. Obviously, there's Alberta's pretty good for diabetic care and all that stuff.
Alberta's actually ahead in the game on that one, because the biggest limiting factor, and it ties in with what we're talking about that Americans didn't quite realize, what's massively expensive for diadiabetics is not even, the insulin's not that bad. So it can be pricey, but it is what it is. Yeah. But what really gets expensive, testing. Okay. Be it test strips for a glucometer, or be it the continuous blood glucose monitors that you can just swipe your phone over. Yeah. Basically, those actually really add up to a lot of money, and often they are not covered by Blue Cross plans or what have you. Yeah. And Alberta has, for a long period of time, before I even started residency here, had what, I don't even know if it's the same name anymore, but it's the same concept, Alberta Monitoring for Health, whereby the patients with diabetes get a certain number of hundreds of dollars per annum for their testing supplies. Yeah. And they just upgraded that a little bit recently. Yeah. So for anybody who's a type 1 diabetic, then because you have to use insulin, or a type 2 who does use insulin, they've increased that amount of money quite substantially, but they cut back a little bit on the amount that was being given to type 2 diabetics who are on pill form medications or just diet, because obviously they don't need to test quite as frequently, because what we really do with the testing, yes, long term you want to see how the control is, but what you really want to make sure is that the person's not having low blood sugars where they could have a seizure. Yeah, okay.
And then the other area, like you mentioned, you work out of Calio Health, that's here in Calgary near 14th Street in the Northwest. Correct. Is that a private medical clinic, or how do they operate?
It's no different than like how my home office is. Okay. We're not Alberta Health Services owned buildings.
Yeah.
But it's still all, for the most part, building under Alberta Health Service codes,
Yeah.
fee for service.
Okay.
But what it is it was started a number of years ago now. Quite a number, actually, probably pushing 20 almost
Yeah.
now, by a number of orthopedic surgeons who wanted a bit more space and office space so that they could see patients earlier, and also have the resources, including a physiotherapy department, whereby those that did not need surgery could be seen quickly and redirected to get the care they needed without having to wait forever to just meet a surgeon that would tell them, you're not a surgical candidate.
Okay.
And it's worked out really well. The clinic runs well. It's and the access to having a number of different specialties now in it.
Yeah.
Now there's also a couple of docs there who are just full-time family docs and do nothing but.
Yeah.
But other than that, we have I call it a number of orthopedic surgeons. I think also a couple of neurosurgeons.
Physiatries?
Or
no, they're all
not right now, but we have on and off.
Yeah.
We also now have a full rheumatology department with 3 rheumatologists.
Yeah.
And who else we got? Yeah, I think that covers most everything.
Neurosurgeon?
Yeah, I mentioned that already.
Yeah, okay. No neurologist? No.
Not right now. There is talk, but it hasn't happened yet.
Okay, all right. And then obviously chronic pain. A lot of people don't know that's probably the number 1 disease in the world right now, right?
Correct.
Like,
and it's expanding.
People talk about heart attacks, diabetes, but chronic pain is all over the world. It's probably the number 1 problem healthcare-wise in the world, right?
Correct.
Okay. And then how do you, obviously chronic pain, how would you define chronic pain? If a patient comes to you and say, hey, Dr. Klasa, I've had pain for 6 months, would you define it as chronic pain?
Officially, the definition that's used is usually that patient suffering from the chronic pain condition for at least 3 months, so on and so forth.
Yeah.
That said, even last night, I was at the AMA, Alberta Medical Association Section of Chronic Pain annual general meeting.
Yeah.
And there was even discussions there amongst some of our board members about that. Does that really sound right? Is it really the way we should be defining it? So how do I define it? I would say if the patient has had a pain condition that is impacting their life, they're somehow limiting their abilities, their activities, it's causing issues for their ability to work, it's causing family issues, anything like that. And it's been persistent for more than, I would go even a little bit under that. I'd say even as little as 2 months. And it's not getting better. You don't see a trend for improvement. That would meet the criteria.
Okay. So chronic pain is a big concern out there. It's not all in the head because, people always say it's very subjective. You can't put a person into a scan and say, oh, he's got chronic pain in his shoulder.
That is true. Because, and I'll give you an example of where that's very clear. Before I took on the chronic pain gig at Callio, for about 2.5 years, I ran the diabetes project for the 6 that got first names.
Okay.
And I was seeing a nice elderly gentleman, now a full-time rancher, but he had also done competitive pro rodeo back in the day.
Okay.
And he came in, his diabetes is going better, he's feeling better and everything like that. But he said, Doc, but again, my sinus are really bugging me. I think I might have a sinusitis and it might have even gone into my lungs again, which had happened to him before. He says, my family doc's on vacay. Can you just take a quick look at me? And they're like, fine. So it kind of sounded like his lungs might have been a little bit iffy for a snap, crackle, pop. And we had an x-ray clinic right there. So I sent for the x-ray.
Okay.
And then I go back to my office to do some paperwork while they shoot the films. We didn't have a radiologist on site. They would read them later, so we read them ourselves. So the tech comes by and says, "You guys see this doc?" I said, "Well, why? Has he got the pneumonia?" He says, "Oh yeah, he's got pneumonia in the right lower lobe. No big deal, but for that, but you got to see this." What are you talking about? So I go and take a look at the film. It's got a little pneumonia there, but his spine, the amount of whitening at all the edges and all the joints that would fit with severe arthritis was arguably the worst x-ray of a back I've ever seen in my life.
Okay.
That said, he had no complaints. He was out in the field earlier that morning working. He was continuing to go back there later on the day.
Yeah.
So you can't make a diagnosis of, like, for example, arthritic pain based on an x-ray. That's ridiculous.
No, I know that.
So basically, you have to budget for the fact that it comes into the art and science of medicine. And you can take films and which might help clarify if you wanted to do injections in a particular facet joint, the chill out pressure on a nerve, and you want to know the location, fine. Do those types of films. But the art is figuring out the diagnosis and what works based on what the patient tells you.
Okay. Obviously, he's a rancher, tough old guy.
By far.
Like, no pain, no gain idea with him, hey?
Yeah.
Just got to get the...
And he had a whole bunch of old fractures in the ribs that we could see. It's like, oh, man, dude.
Okay. All right. But obviously, chronic pain is a real concern.
Yeah.
I mean, you were president of the Pain Society of Alberta at one time initially. Yeah. We are always a sponsor, Grover Law Firm. We love sponsoring the PSA all the time.
Yeah.
Society of Alberta. I mean, it is a big concern.
Yeah.
Obviously, there's resources for people to go out and get treated.
Yeah.
Healthcare, I mean, obviously, nothing in life is perfect. We know there's problems like, getting your tire fixed.
Correct.
Or something like that. You just have to be patient with the healthcare in Alberta. Is that way generally you can tell the public?
Very much so. And since the PSA started, the Pain Society of Alberta, and then which helped form the AMA section of chronic pain as well.
Yeah.
Honestly, I'd say in terms of chronic pain management and resources thereof, Alberta's by far the best in our nation.
Okay. And talking about chronic pain, every Canadian suffers chronic pain because our national sport is hockey. And an NHL team from Canada has not won the Stanley Cup since your Habs won in '93.
Correct.
So what is the problem? You're the doctor. Diagnose the problem with the Canadian hockey teams. Why can't we win a cup? Because Vegas just won. Like, of all the cities in the world, Vegas just won a Stanley Cup.
And I believe you were at that event too. Years gone by where we met up with Brian Burke.
Yeah.
After you lucked out at the poker tournament for the Flames.
Yeah, that was back when he was president of the Flames.
He's
gone now.
Yeah.
I don't know where he is now.
But he made a very fair point on that one, which was that if you've got like 30 plus teams in the league, you're technically not officially behind the 8 ball unless you've gone past the number of teams in the league years without winning a cup.
Yeah, I know.
Now, would any of us have anticipated in 1993 that it would be this long? No.
Yeah.
But at the same time, was it really expected and was it normal that from like the mid 1970s until 1993 bet like either 50% or damn close to, or maybe more of the Stanley Cups were won by Canadian teams? So I don't have an explanation for it, but I wonder if it might just be that type of a situation. It was a blip of too many Canadian teams arguably winning for a stretch. Now it's the reverse.
Okay. So, I mean, of all the Canadian teams, the next one to win a Stanley Cup in Canada, you probably pick the Habs, right?
I'd love it to be.
Yeah.
But if I do believe the team to the north of us, if they establish stability in goaltending, there's no reason why they shouldn't win it next.
Yeah. Okay. So, I mean, it's just very interesting. Like since '93, it's been 30 years now.
Yeah.
So we've had LA win a couple cups.
Yeah.
We've had Anaheim win a couple cups. We got Viva Las Vegas winning a cup.
Yeah.
We got Dallas Stars winning a cup. We got Tampa winning 2 or 3. Carolina's won one.
Yeah.
Rangers have won one. I think it was '94 they won theirs.
Yeah.
Messier.
The Rangers were funny. I still will always remember their because that was the year after the Habs won the cup. And at the Stanley Cup parade the following day, this nice, very, very elderly-looking little gentleman wearing a T-shirt.
Yeah.
Proud Rangers fan. Now I can die in peace.
Yeah.
Because it's been over 50 years.
And that was a Don Keenan coach.
Yeah.
But they haven't done anything since
Mike Keenan.
Yeah, Mike Keenan. So they haven't done anything since '94.
No.
0 in 20 years.
And then, then take a look at another team in our great nation. Oh, it's been since '67 that the Maple Leafs have won a cup.
Well, the Buds.
So it could always be worse.
Yeah, and they have a pretty good team, but I don't think they'll ever. I don't know if they'll ever win a cup. Hopefully one day, but it is what it is. Chicago's won 3 or 4 now.
Yeah.
Pittsburgh's won. They had Lemieux, they had Crosby. I think they've won 5 or 6 now.
And then when we were growing up, it was the Detroit Dead Things.
Yeah, the Red Wings.
And then the Red Wings won a couple, but now they're kind of edging back towards Dead Things.
Yeah, exactly. Okay, so there's no diagnosis for you for how to solve the problem as a doctor looking at the NHL teams in Canada?
Not right now. No, I don't see that one.
Okay. And then obviously, you got your Habs and you moved out here to Calgary.
Yeah.
I know you're season ticket holders with your wonderful wife, Rita, at the Okotoks Dogs.
Right.
If people are not familiar with the Dogs, I've been out there several games. I mean, we sponsored one game, I think.
Yep.
I haven't been out there in years because of COVID and all that stuff.
Yep.
But, tell people what the Dogs experience is like out in Okotoks.
It's really fabulous. And for anybody who's not familiar with it, the Okotoks Dogs play in the Western Canadian Baseball League. And they're basically the equivalent of, if anybody knows, Cape Cod League. Mm-hmm. It's collegiate players from Canada and the States who then get billeted, just like the Western Hockey League hockey players do, in community homes and play during the summer to expand their skills, and also get some part-time jobs through local businesses to learn business skills, and have some extra cash to come back to university in the fall.
Okay.
And the Western Canadian Baseball League is franchised exclusively in Alberta and Saskatchewan. Mm-hmm. And the stadium in Okotoks is an absolute thing of beauty. Yeah. And when you actually do go to support that team, the Dogs are a complete nonprofit. So everything's going back, all profits, to help the kids and to help them with their learning the game and learning education.
So it's called Seaman Stadium. It was donated by the Seaman family.
Yeah, Don and Doc Seaman were the major players in that one, yes.
Yeah, those were the old Flames owners.
Correct, the ones that brought from Atlanta.
Atlanta in 1980, okay.
Yep.
Have you been to other stadiums in the
WCBL?
Yeah.
The only two, the one, but it was for a different game, a different league, because for a while the Edmonton franchise was playing out of the Telus Field in the River Valley, where the old Edmonton Trappers used to play.
Okay.
But now even they have taken a theme from the Dogs, because the Dogs used to play at the Cannon Stadium near McMahon.
Yeah, Foothill Stadium.
That was pretty
That's I went to one Cannons game and never went back. It was just too windy. It wasn't not a good atmosphere at all.
And not to mention the number of mosquitoes.
And the sunflower seeds flying around because of all the wind going on.
Correct.
Yeah.
I still
have flashbacks of the game sitting in the rafters.
You're sounding a little post-traumatic. but it was a similar circumstance where they just weren't getting a lot of attention for the Edmonton prospects in the city of Edmonton proper.
Yeah.
So they are now they have almost completely completed a new baseball stadium in Spruce Grove that is very similar to Siemens Stadium.
Okay.
But they've taken it to a whole new level. Actually, they've even developed condos that just past the outfield fences, and one where if you're on your balcony of your condo, you essentially get tickets for every game by watching it.
Sort of like Wrigley Field.
Pretty much. Yeah. And the name of the condo complex, I thought this was brilliant. The DiMaggio.
Okay, that's cool. Are the condos for sale now?
Yes. Yeah.
Okay, what are they going for?
I didn't check.
Like 300 or so, or 400? Spruce Grove can't be that expensive. It's a bedroom community.
But it's bedroom community. But I would guess if it's a 2-bedroom, it's probably going to be like anything you would pay in Airdrie.
Okay.
It's not going to be cheap.
It's called the DiMaggio condos.
Yeah.
I have to check that out.
Yeah, it looked cool. Okay. That's all I'll say.
So how are the Dogs doing this year? I think they're halfway through the season already.
Well, not quite. The halfway point would hit around the second week of Stampede, because the Dogs are also hosting for the second year in a row the Western Canadian Baseball League All-Star Game.
Okay.
And
what is that?
That is on the second Saturday of Stampede.
Okay.
And how are they doing? Currently number one in the league.
Okay.
And I think in their division, 2.5 games up on Sylvan Lake.
Okay, all right. So they're up in the division. They've won a couple championships in their history as a team. Yeah, they've won
so far 6.
Yeah, okay.
If they win one more of existing franchises for the WCBL, which through different initials, albeit, dates back almost 100 years.
Yeah.
If they win one more, they would become, of the active franchises, the most won.
Okay.
They would be like the Montreal Canadiens of the WCBL.
Oh, the New York Yankees of Major League
Correct.
Baseball. Okay, so they're big time money down there. They got a big time stadium
and also a
big time
full
support.
Well, not to mention that, also a full infield training center. There's this one called the Duvernay Training Center. It's a building with not just the weight rooms and all the rest, but a full infield for practice indoors.
Okay,
So kids can train in winter.
So, winter time. Okay, so they come back for the winter and train?
And not the kids on the main dogs team, but the dogs program goes all the way down to Pee Wee.
Oh yeah, that's right. Okay. So you'll be there at the Dogs game for Canada Day with your wife again, and all the nice fireworks going on.
Biggest fireworks in I know for sure in Southern Alberta. It might be the biggest fireworks in Western Canada.
Wasn't there a year that the field caught on fire? You said. What was that story about?
It's no longer going to happen there because now there's a gas station built on.
Oh, the Shell gas station.
Yeah, where the Shell gas station is out past the outfield fence before it existed.
Yeah.
They fired off the Canada Day fireworks at one time there, and there was some scrub brush that I guess had grown a little higher than they expected.
Yeah.
And all of a sudden, they're still continuing the fireworks and a show. They never ended it.
Okay.
And all of a sudden, a couple of fire trucks come by, and guys hook up to the fire hydrant and are putting out the brush fire while everybody in the stadium across the street is still watching the fireworks display.
Okay. All right. So yeah, I really appreciate you showing up. I mean, obviously, healthcare is a big thing. It's always good to get a doctor's perspective. You've been in Alberta for over 20 years. Always had a very, very educated man in medicine. You're always training yourself and taking care of your patients. I have utmost respect for you as a doctor, and obviously you work at Calio Health with chronic pain and diabetes. So I thank you for showing up. And go Dogs, go! Hopefully win another championship this year. Okay.
With you on that, bro, and thanks for having me. And also, gotta say, to this very day, I'll always say the same thing. Your dad was the sharpest, most wise ass, the politically incorrect and correct, and the physician I have ever met in my career. Yeah. Dude rocked it.
All right, thank you. Well, you rocked it on this podcast. So everybody, thank you for tuning in again for this episode. Obviously, it was good to hear from Dr. Klasa, family doctor perspective, healthcare. We're all concerned about health. It's the biggest concern we have in Canada. And until next time, have a great evening. Cheers.